really busy. And I know it's a hectic week as we come off the holidays and back to work. And hopefully you can all hear what's going on. So welcome, Happy New Year. It's nice to see all of you during this yet again, just another challenging time. I think we had all hoped we'd be somewhat back closer to normal. But I am thankful that you were all able to make it this evening. I wanted to, and we wanted to meet with you because we are ready to launch this study. And it's been a long time in coming, but we're very excited. And so we wanted to update you on the timeline and kind of review with you the next steps as we go through this process. But then also we have some key questions and feedback that we were hoping you could help guide us. And then also obviously just want to open it up to any questions you have as we move through these next phases. So to just catch you up where we are, we have drafted a press release that will be going out to the federal elected officials in for this area, for your communities, as well as the senior DOH leadership and New Albany leadership late this week. It's in the final stages of preparation now. We will then follow communication to the local elected officials, the local mayors at town boards, the city councils, as well as the local health departments, with directly from us, letting them know that the study has started. And what we mean for all of you, just a reminder, what we mean by that is we will begin to mail invitations to participants in first in Newburgh, and we will start in Ward 1 of Newburgh to mail out the invitations to call us and complete an eligibility screen and to schedule an appointment with our clinic staff. So our clinic is up and going in Newburgh. We had several of you come in for our soft launch, and you also recommended others for our soft launch and provided wonderful feedback, and that was tremendously helpful. So we're very excited to now begin scheduling our formal invitations. Hoosick, we will actually also be ready to send letters beginning probably towards the end of next week to Hoosick community members. We anticipate that the clinic visits there can begin the first week of February. And we would actually like to begin, just like we did in Newburgh, with CAP members and others that are known to you who might be willing to participate. And what we call a soft lunch, it'll be a little shorter in Hoosick because we won't need quite so much time and we don't have the holidays in the middle of all of that. But to really be first in line, so to speak, to help provide and give us feedback. And so it might take a little bit longer than the typical visit that we have planned, but we really do want to have some feedback and your ideas. And also, as you, particularly for our CAP members, as you're out in the community and as we start talking about the study and answering questions about the study, I think it's helpful for community members to know if someone has actually been through the clinic visit, and then you can speak to what that's like and what the experience was. So we will be sending out separate emails to the CAP members from Hoosick Falls and the Hoosick area next week as well to see if you would be willing and able to be part of our initial visits, and if you have a recommendation for some friends and acquaintances and family with their permission to share their email with us so that we can contact them to be some of the first ones scheduled in the first couple of weeks of February.
Erin, if I can interrupt, would you send that to Nancy and Carrie for the CPWG group? Because I imagine those people would line up quickly.
Yes.
And because their next meeting's the 25th. So if you can pop her off a note and give people a heads up.
Okay, we can do that. That'd be great.
Thank you.
And yes, and actually that group, because I think I've been at meetings before, they've actually asked me to draw their blood immediately. And I said, well, I don't have the tools with me, but we can definitely do that.
And
so
also the letters you're sending out, is that the doctor's letter, the doctors that you put on the list? Because we have some address changes on that for you.
Yeah, so that's going to be, the letters going out now are to the elected officials and at the federal level, and then we'll send the email communications to the local elected officials and local groups. The providers letter will go out, letting them know in a couple of weeks, and that's exactly why we wanted to share that list with you. So the providers notice now is just to let them know that the study is ongoing and to get and how to contact us. And then throughout this process, we'll be working with you to come up with a plan to share results as we learn them with providers in terms of what they mean and what types of information study participants will be getting, so they're not surprised when.
Okay, should I just email you with the address corrections?
Sure, if you have address corrections, and then later on today, what I hope to get to is if there's anyone missing from that list that we need to add, we would like to know that as well. And if you need time for that, that's fine. And we can keep adding to that list as we move forward. But if we wanted to send the initial list and see, so that'd be great. If you email those to us, we can get those changes in.
Okay.
So that's, so that in terms of the process, we'll be starting the clinic visits in Newburgh. We can schedule immediately. We'll begin the actual clinic visits in Hoosick the first week of February, but letters will start going out to both communities late this week, early next week. You will also, we're working with an organization called OpAd who will help us with some of our social media postings and digitized social media posts with that. We are also printing signs and posters and some extra fact sheets and flyers. And for those on the CAP, if you would be willing and are interested in helping us distribute posters to hang in different areas and to provide fact sheets, we can certainly get those to you. We, in Hoosick, we had originally planned on lawn signs, and in the middle of winter, that didn't seem to be particularly efficient. So we've made posters for now. We can certainly make lawn signs as we get into the springtime. But we will, and we can come back to that and can again send a follow-up email after the meeting tonight for those who might be interested in helping us with that activity. I'm going to pause for a second and just ask if there are any questions about the timeline or the process for how we're rolling out the invitations. So just, oh, Ed, hi, Mr. Lawson.
Hello, I'm sorry, I apologize. I joined a little late. So I had a couple of questions. One, yeah. I know that the letters are going out. What about the coordinated sort of information sessions?
Yep.
What is the plan for that? And then the other question I had was around social media posts. You mentioned that you're working with an organization that is going to help you with those things. And I'm just curious about what that rollout will look like and what kinds of information will be shared. And has that organization worked in communities that are similar to Newburgh, and what has been their effectiveness as far as replies and compliance, et cetera?
Excellent questions. So in terms of the rollout, and I'll start with Newburgh, we have initiated discussions with Giselle Martinez, who is the ward leader in Ward 1. And so just a reminder too, that when we start the mailings, even by ward, it will be anywhere from 75 to 150 a week, so that we won't get through the entire ward all at one time. So one of the goals tonight is to brainstorm a little bit about where we should have some activities, and then we will be scheduling some events in coordination with Giselle and others on the CAP and in the community for different activities. So we haven't finalized where those activities will be, although I would anticipate and hope that one of them might be at Black Vanilla Cafe, since I know that's in Ward 1, and we've had some very helpful meetings there in the last few months. But we had spoken, there are several churches that Giselle was going to put us in contact with. So that is the plan for January and February, to have several events in Newburgh. beginning in Ward 1, and then we'll work our way through the calendar. So that's still very much in development. And if folks have some ideas, and that's a little later this evening, that's one of the main topics of conversation. And then Hoosick, it's the same discussion. There, obviously you don't have wards in Hoosick, but in terms of plotting out some school board meetings, town hall meetings, where you think might be most appropriate for us to schedule community events and meetings to come and answer questions, and the best modality, if people are more comfortable at this stage over Zoom, or if we should be in person. In Newburgh, we're certainly planning a number of in-person events, and so we'll follow the members' leads in terms of what they think might be best. In terms of the social media, so there are two components to that. One is the op-ed organization that has primarily with Facebook and different Facebook and Twitter and advertisements that it's an advertisement type outreach that has, and it's a group that's worked with DOH previously. But in addition to that, the plan is, and another question for the CAP, for those of you on social media, like I know Laureen runs a Twitter account, we would also very much need advice on which, how best to reach the different neighborhoods and community members. So I know from a visit with Black Vanilla Cafe that some of the traditional Facebook posts and websites won't necessarily resonate with people who live there. So if we have connections or ideas on how to advertise local newspapers or local radio announcements, we've talked about the school radio clubs and things like that, that we should be reaching out to. We would like to start getting that list together so that we can send in request and work with folks to send out that campaign information.
Hey, Erin,
Yes.
Just to chime in a little bit on what
Yeah,
op-ed does, so that the ask maybe could be a little bit more specific. Op-ed already has identified the full recruitment areas in both Hoosick Falls and Newburgh, and has looked at block groups of where we would be particularly recruiting from. They've also overlaid demographic data, so we know by age, roughly how many people we want to recruit. Using that information, we've developed social media posts that had two objectives. One was to build brand awareness so that when people got recruited, they would know, oh, that's the multi-site study. I saw something about that when they got their letter. The other component of it was not like statewide, to just build program awareness so people who are interested in the study could check out our website. Anyway, we heavily targeted exclusively in Hoosick and in Newburgh, and basically sent to those IP addresses that match the demographic profiles. So it's a very general kind of an approach to build awareness in communities that we're recruiting from exclusively, but also to just provide background as well on the study. So one was check your mailbox as a call to action, and the other one was learn more about PFAS and health. And we probably had, 17 different types of messaging going out in both English and Haitian Creole and Spanish, right? Did we do the three languages, or was it just English and Spanish? I don't remember.
I think just English and Spanish at this point.
Okay.
And we can send the Haitian Creole to different
Yeah,
contacts.
and I misspoke on that, sorry. So any event, that's kind of a larger, kind of less focused kind of campaign. What we're asking for now is, for those people that don't really, now that we've launched, use social media, where should we go for out of home messaging? One of the things that I've heard about, which is good, which I think if we have extra money, we could talk about with our media buyer, who we use at New York State Department of Health. Op-ed is their name for all statewide media buys. We can find out if other applications like Nextdoor or, I don't know what's applicable necessarily for your communities, but other local kind of marketplace websites might also be an opportunity for us to, loop back if we had extra money. So anyway, thank you. I just wanted to, while we asked about additional places, I just wanted to talk about what we already covered.
Yeah. So actually, that's a good place to pause for a second and ask if there are ideas or thoughts on who we should contact, or if we should have a separate call to discuss very specific to outreach. Yes, Mr. Lesson.
Yeah, so one of the challenges in communities like Newburgh, I'm not that familiar with Hoosick Falls, is that not everybody responds to the general. So that's why I asked the question.
Right.
And so in communities like Newburgh, what's really effective is text messaging. And so you can you can imagine that people who don't have the internet access or the full smartphones, but they do have phones, and they are able to get typically text messages. And what we found in communities like that, that works really well at getting messaging to folk. And so I appreciate everything that was shared about this social media space. And it sounds really robust, but we know the challenges in Newburgh in that a lot of the folks that have been tested are not. It's a disproportionately reversed demographic, so there are not a lot of Black and BIPOC folk being tested, and we want to try to get as many of those folks engaged in this study as we can. So I think we really should explore. And I can share a couple of websites or systems of text messaging where you can get. It has the same social media effect, but it's through text messaging. If you ever watch people, the human dynamic is very interesting. When their phone rings or buzzes, they automatically look at it. And so if we're really serious about getting messaging out to people, we have to go to where they are. And where they are is not going to be necessarily on social media checking for this. It's probably going to be in text messaging.
So we're definitely, once someone actually enrolls, we're definitely asking them for permission to text them about the clinic and for future contacts. But for this initial one where we don't necessarily have their cell phone, do you have experience with how best to reach people through a text?
Yeah, so it's usually, a lot of school districts use it.
Okay, yeah.
Because they do have access to information. And
right.
So this is where the conversation with the Family and Community Engagement Director might come in handy.
Right.
Also, care providers will have information about their patients and patient portals. So basically what we're trying to do is a both and belt and suspender type of approach, use various media to get information out to folks. And so the other thing too is that you can also target certain people in the community that will share information. So if you have a leader or a community organizer who has access and a network, they can facilitate, messaging out to folk. It's just about what I really want to highlight is being intentional and purposeful, and not to take an approach that we're going to, do what we've always done in these types of situations, because it may not be as impactful and effective.
I fully agree. And really, this is like a multi focused approach is what we envision. So it's multiple layers with that. And, I'm wondering too, I'm just going to, and Gina, hey, Gina, are you able to mute? Okay. One avenue, definitely we can, when we have our meeting with the school district, we can ask if they would be willing to either put a text out. I don't know how, just knowing our school district, their level of comfort with that. But I'm also wondering if churches, we can ask them. But I like the idea since we are trying to work closely with the ward leaders, they might have a text list that they'd be willing to help us with to get the word out through that. But I definitely like the idea of trying to pursue this. And we can also reach out to OPAD if they have any thoughts on how to access that. But I absolutely like that idea specifically, because I agree. I think getting a text is we're more likely to get people to at least notice the text and direct them to who to contact. And, you know, there might be something similar to in Hoosick that we could use. Yeah.
Aaron, Pat Daly is now the current co-chair of the CPWG. We had new elections. And since, you know, he's at the school, I'm sure he'll be able to help you out with that.
Okay.
And one other question for the people who do want to sign up first, do we have to let you know individually because of HIPAA, or can we just send you a list of names? Or
so what we're asking is we'll reach out in a separate email to each of you so that you can respond to that. And then if you have names and addresses of people we can contact to ask, and just say that you were recommended as someone who might be interested in.
well, like the members on the CPWG.
Yeah,
I mean, if
so
they all want to sign up, can they just send you an email
They can send us an
individually?
email. Sure, they can do that. Yes, we can do that. And so we'll send an email with that information so we can share that with CPWG, and they can just let the members know that.
Great, okay.
That's the process we did with Newburgh, so I think that'll work fine. Okay, so I love the idea of text messaging and working with our partners in the community organizations, especially as we start reaching out to some of the organizations. If they have contact lists and texting there, that would be wonderful. Are there any other ideas or thoughts or feedback on how to reach people? Are there local papers or newsletters or things like that we should let people, you know, send a press release to?
Erin, I just wanted to ask Dr. Bell, I just wanted to ask a question. So with respect to the op-ed, are I think I heard that they made contact with certain community agencies. Is that contact, does that mean with their social media links, so that when they post or share information, would say for example, Black Vanilla, and there's a lot of people that follow Black Vanilla, that the information about the study would be there? I just wanted to get a
Yeah, no, that's a great question. I'm going to punt to Gina because she's worked with them more closely.
Hi, Mr. Lawson. So no, the way that the platform works is that people are individually geo-targeted based on their IP addresses. So it's not at a group level. What we might be able to do is, if we had a list of organizations, we might be able to spoon feed that to OPAD and see if they would, you know, include them, you know, in their push for their feeds. I've never done that before, but you know, if we had
I'd like
a list,
to try to do that.
Okay.
Yeah,
I'd like to try to share a list with you. If that
That'd be super. If you
Yeah.
have a list, yeah, if you could, and I know we have a call tomorrow too, but if you have a list, I can reach out to OPAD in the morning and see if how that would work.
Yeah, because it would be cool if they shared it, you know, it's like a way of getting an endorsement, which I think probably Mr. Lawson was thinking about.
Okay.
So if we have something similar also for the Hoosick Falls area, I think we should include that as well. So that would be a list of groups like that, you know, y'all think get a good amount of traffic, and we can see if OPAD will just fold them in. By the same token, Erin, we should ask as well to be added, so that you can see the links and stuff. So we should get back to them anyway.
Okay.
All right, hang on a second, I just got confused. So if we were gonna hit up the newspapers, who would be putting it to the newspapers? Is that you guys? Is it DOH? Is it?
No, we would do it. It would come from UAlbany, but we have a joint press release, but we can also adapt it to wherever we're sending it and offer to, you know, do a short interview or answer questions if they want to do more than just place an ad, you know, there, or and we can also in that same email, ask if they'd be willing to share this on their social media accounts. So that would come from here.
Okay, great. All right. Well, there's like 4 around this area, so I'll put those in the email for you tomorrow.
Okay, thank you.
Aaron,
Yes.
I'm thinking about a lot of things here. There are a number of community groups also. There's Safe Harbors, certainly the Newburgh Clean Water Project, the Armory has a number of events on Saturdays usually. Anything going on at the library for that kind of stuff. With the water issues going on in Newburgh, even Riverkeeper and Scenic Hudson have been meeting in Newburgh quite a bit, and they do know Newburgh area. I don't know if those things would help promote this project. You were talking about visiting with the school district. Where are you with that?
So we've had lots of back and forth. So 2 things. It's Mr. Lawson's on the agenda for Tuesday night for the meeting that's upcoming to inform them of the RAB and the fact that the study has launched and updates also related to the RAB. There is no back and forth at that school board meetings, and that's typical of all school board meetings. It's just an opportunity to present. And then we have put out a request to schedule a meeting with Ms. Peterson, who's the community engagement, family and community staff member director for the school district, to meet with her and have a sit down with her, walk her through the study and ask, and answer any questions that she may have as a starting point. And then we'd obviously like to reach out more. And then we've had several school members have actually attended the meetings we've had at the Black Vanilla Cafe, which I think was as well.
Yeah, Ed is right about the text messaging, and the school has, like a robocall kind of system. So, if it's snow day, some other kind of event, they can get calls out pretty quickly. If permission is given to you to do that, you'll be able to reach an awful lot of people.
I also, as you were talking, I was recalling, so is the parent teacher organization too, if they have, I don't know if in Newburgh and Hoosick, they have something similar where I know here, the organization can also send out text messages to families that are part of the organization.
Yeah, that might work by individual building. There
Okay.
to be, especially at the elementary level, those organizations are better structured there than at the secondary level.
Yeah.
But again, there certainly could be older brothers and sisters even.
Sure. Yeah.
So, but each building will have their own a PTO that has a president and a board and all that kind of stuff going on. Yeah.
Super, excellent. Okay, and I jotted down here the libraries in both communities would also be, I think, critical. And again, I'm happy to travel and meet with people. Our staff at the 2 clinic sites are happy again, we've hired local people who know a lot of folks in both neighborhoods. So that's been particularly helpful as they've started to meet people and train for the clinic visits. So I'll reach out to Op-Ed in the morning, and Ed, if you could send a list in it as you, and if you think of other ideas or have other contacts or lists that you'd like us to include as we start reaching out and sending information, by all means, feel free to either email me or email the PFAS at albany.edu email, and we'll follow up on that and add that to our list. Any other thoughts? Okay, I got a thumbs up. I like that. Okay. So the other thing, and we chatted a little bit about this last time, and it's again, this is where the communities might differ a little bit. I know in Newburgh, we've done a couple of in-person events, and we anticipate doing a couple of, not a couple more in-person events at churches and community groups, perhaps at the Armory on a Saturday, and at other events to answer questions in person. That's going to be important for the community. Huzik, when we brought this up last time, it was less of a people weren't sure what would be most needed. I think definitely, if you agree, certainly presenting at the school board and perhaps a town board meeting or a CPWG meeting, which the CPWG folks know us pretty well at this point, but happy to come back out and talk. But are there other folks we should come and do things in person or do something over Zoom, or what do you think would work?
For Hoosick Falls again, I would talk to Pat Daly. I don't know if you'd want to do something at the school.
Okay.
If you don't have his individual email, I can also send that to you.
We might have it, but if not, I'll let you know.
Okay.
Anything else? Any other places? I know Petersburg, we had talked about the town meeting in Petersburg, but late when we get closer to sending inviting the Petersburg folks, because we'll do that in the same mailing.
Ira, I'm pretty sure Ira's on.
Yep.
But possibly
Yep.
setting something up at the Memorial Hall,
Okay.
like a Q&A info night would be good.
Okay.
Yeah, that might work in conjunction with maybe just before a town board meeting too. So you could do a little informational thing like you did last time.
Sure.
Try to get the whole C8 committee there and get as many residents as possible, and then maybe get you to speak in front of the town board before the whole meeting starts and get you in and out in a 15-minute thing before the 2-hour meeting. 3-hour meetings drag on, so.
Dr. Bell, real quick before they realize that I unmuted myself. Have you spoken to, Happy New Year, everyone. Have you spoken to our city council regarding doing a presentation there, either at their work session or at an actual city council meeting? They meet, the work sessions are the Thursday before the second and fourth Monday of the month.
We had briefly discussed it. They actually reached out. One of the staff members reached out to us asking to advertise on the and put a notice up on the website, and so that's definitely on our list. And we had chatted a bit about that with Anthony Grice as well. Is there somebody we should contact to schedule that?
I think you could reach out to the city manager, CC
Okay.
Michelle Kelson, our corporate counsel.
Okay,
But it would be great maybe for people to actually see you in person and hear.
absolutely.
Again, everyone doesn't have access.
Yeah, okay. Thank you for that reminder. We did, it came up a little bit when I was down there a few weeks ago, and then, and I think to have that.
And I think we'll have it's the same challenge, Dr. Bell, that you have to be a citizen or you're a resident to be able to speak. So it would need to be one of us.
Okay,
And I think Anthony Grice could also help facilitate.
okay,
So
and I'm happy to be
you
there.
might want to reach out to him
Okay,
and indicate that we want to present and find out what the process is.
okay,
But I think that's a great point.
okay, excellent.
Can I just follow up for the city council meetings in Newburgh, the date, when do they occur? What are the dates?
They are the second and fourth Monday of the month, and their work sessions are the Thursdays before those Mondays.
Okay, and
But
then
again,
okay, sorry, Gabrielle, go ahead.
no, go ahead.
And then the same for Newburgh for the next town board meeting. When is that occurring? Does anyone have a date?
Or Huzik, I think you mean, right?
Oh, sorry, yes, Hoosick Falls, thank you.
The village board meets the second Tuesday of every month.
Okay,
Petersburg is the third Monday of each month.
okay, thank you, guys.
And just to backtrack real quick, since they're not paying any attention to me. regarding any town hall meetings or anything like that in Ward 1. When the Newburgh Clean Water Project first began, that's where we were in Ward 1. So we used the Carpellis Museum, we used SUNY Orange, and I'm curious as to whether or not you're working with Mount St. Mary College and SUNY Orange. They both have nursing programs, I think. So maybe there's something that they have going on that we could hook up,
Okay,
connect with. But yeah, and let me know if you need any help there.
okay, thank you. Those are great ideas.
They're both in Ward 1.
Okay. Beautiful. Excellent. Thank you.
Yeah, and I just wanted to say quickly that Giselle Martinez did want to make it, but she had a previous engagement. But I will be following up with her soon for us to meet and make some more plans for Ward 1.
SUNY Orange also has a public health program. So we can reach out to both the public health and the nursing programs to see if they have any events, and we can come and talk to the students, which would be great.
And by the way, I'm in Ward 1, so if anybody needs anything, just
Excellent. What
Yeah.
we
Let me know.
Sure, I'll reach out to you for sure.
definitely be reaching out. Yes. The more hands, the better. So excellent. Also, just one last update with Newburgh is we do have an agreement, yay, in place with Perusa's Taxi. So if families and participants need transportation to the clinic visit, we have worked out a process for that to happen, so people do not have to pay out of pocket for the taxi ride. We're happy to explain that if people have questions, but that was something we've been working on so that we could do a direct pay from here and not have people worry about getting reimbursed.
And I have a question regarding that. I'm sorry. And I apologize. I dropped the ball, but there was just like the campaign. It was so much going on. However, I was a taxi dispatcher for many years ago. So I'm just curious, especially with COVID, sometimes taxis like to double up on fares, right? So just curious as to if they have a fare to pick up one of our case studies, that they're not picking up other people on the way. Like, so how are we gonna, I know it's gonna be difficult, but what are we gonna require for them to show us the fares, the pickup place, the drop off place? Like how?
Yes, that's part of the SOW, and that's exactly why we were working with them. Although you are reminding me that we should probably put in that SOW that it's that it's from point A to point B with no stops in between. And then confirmation from the clinic staff when they arrive, and then when they get picked up. And so my staff will be scheduling the pickup to go to the clinic, and then the clinic staff will be scheduling the pickup to go home, and it's one stop in between. But Gloria, we should probably clarify, not probably, we should clarify that especially in the time of COVID, that it's one family.
Sure, yeah, I can reach out to them and confirm that.
Okay, thank you for that, Gabrielle. That's an excellent point. Any other thoughts or ideas in terms of meeting with community members, answering, this is as much, yes, it's about recruitment into the study, but it's also making sure the community knows the study is going on, and to answer their questions and to make sure that they're comfortable with me and with the folks participating in the study, and that they know that we're here as a resource as well to answer their questions, to provide that information as we can. So are there other ideas, other needs, other questions or concerns?
Just another part of that, the link between the Washington Lake contamination and this project is established well.
Okay. So the background of this, okay. And I think, and Ed and I have talked about this before, I mean, doing things when we do in-person events or even over Zoom, I mean, to tie in and do things in collaboration with the RAB makes perfect sense to me, in describing the two components. So if there are things that we should be doing together, we can certainly do that, just like we'll let the school board know about, the update with both activities going on.
Aaron, were you planning on scheduling were you guys an open house for the one here in Music Falls at some point?
We can, and that's, I think Gina was just sent me a chat reminding, and so if people think that an open house would be of interest, we can certainly schedule that for February. And schedule a time and have that. And if Newburgh thinks an open house is a good idea, we can certainly explore that.
Because I think one would be good, but if we could like include in the press release you're going to send out, that we're planning an open house sometime in February, watch for details, because then people know they can come in and, and
I think for the press release to the local folks, that makes a lot of sense. And we can definitely adapt that press release to include that we're, and so we can work with you. And
then if some of us who signed up, can come in and look around too and get our bearings.
Sure. Okay.
And maybe one or two of us can be there and help facilitate or something.
Yeah.
That'd be cool.
We can coordinate with RTI and the clinic staff for those who do want to come in that first week of February for their early visits to have an early kind of meetup. We did that with Mr. Lawson, and we can schedule a time to do that, and we can be there too, so you can walk around and see what it's like, and then have the soft launch visits, and then I think an open house kind of the second or third week in February makes sense in Hoosick, and we can work with you on that.
Okay, great.
And all that. Yeah, Emily just pointed out, it depends a little bit on COVID, and hopefully by mid-February, I would hope. It's gone up so high that it'll go down just very quickly. But we'll, as with everything that we do, we'll keep an eye on that with that. But that's a good idea. Newburgh, we've been batting around the open house with kind of mix. I mean, what do people think? Do we schedule one in Newburgh, or do we go into the communities? And we've had mixed reviews on whether or not we think that would be an open house would actually be helpful or not. It's a little different in Hoosick because the clinic's right in the middle of town. Or if you want to think about it, you can let me know too. All right. The other piece is we chatted briefly about at the beginning of the call, the other group that we really do want to start opening up a dialogue with and discussion with are the local providers. And so this is local pediatricians, local general internists, family physicians, but also I want to be broad in this because not everyone has a physician, right? So some people go to a clinic, some people might go to the emergency room. So we're trying to establish an initial list for both communities of the different, not only individual providers, but if there are organizations that provide some level of care to the community members, and wanting to review that list to see if there's anyone to add. And I know Lorraine mentioned she has a few address corrections to send us for the Hoosick list, which is super. And the idea again is we want to let them know the study has started, but then as we get moving and get data collected, start sending out information to the providers in the community so they know what type of reports are being sent to community members in the area, and as guidance comes out for providers in terms of how to interpret the reports and answer questions that they may have, to make sure that they're aware of what's happening, and also offer, as we always do, to come in person and meet with folks. And so Elisa sent an updated list right before the meeting today that puts everything into a spreadsheet so that you have time to look at it. And we can certainly take names now, but wanted to give everyone a look. So I'll just pause for a second. And was there an initial thought in terms of when you first saw the list of folks that were missing, or do you have ideas or feedback, or how would you like to proceed with this? So what we can do is there are two tabs on the Excel spreadsheet. We sent one for Newburgh and one for Hoosick Falls, sorted by name of physician, but you also may want to look at column, and for Newburgh, look at column C, which is the office name and the group practice. So for example, we have Planned Parenthood on there, and in some of the local clinics, but we just really want to make sure we're not missing any group in particular. So if you could take a look at that, and then same with Hoosick, if there's a group there. And and we do have the Vermont. I was just making sure we have Vermont folks on there because I know many people in the area get their care in Vermont. If you could just take a peek, and if there's another organization too we should check with to look at the list for us, let us know. But again, we want to draft some language so that we can let them know the study has started and why the study is happening and what the goals are and what people in their communities are going to be receiving in terms of information, so they're not caught off guard, so they know what's happening. Gina just asked if we could do a provider WebEx in addition to mailings, and yes, absolutely. We can definitely schedule a WebEx for physicians and clinicians and providers that want to learn more. We can definitely do some informational WebExes and videotape, and we can record them and post them too, so people can listen to them on their own time. Any questions?
We have one. Is there
Yeah.
a provision for when you start getting health study participants and did they tell you who their physician is, where they're getting their medical care from? And
I've
maybe,
asked that. Yeah, I've asked that question before on other studies. I don't think we have a mechanism for that in this study.
So
We can
say
double check. Yeah.
my son lives in Pittsfield,
Yeah.
but he lived here for the first 22 years of his life and drank the water. That means he can't participate because he lives in Pittsfield?
No, he can, if he lived during the time between 2005 and 2016, and on the private well, in your case, or in the water boundaries we've declared, then people like that we know of in theory can participate. Yes.
Right, he can participate, but that information does not get sent to.
So I see what you mean. No, we can, all right, so we need, that's information what we can add, it's the operational side of my brain that's trying to figure this out. We'll discuss this. I think you're right in terms of if they want to add their provider, that we can, if they have a specific provider they want to make sure we communicate with. So yes, we can figure out how to do that. Yeah. So we'll definitely discuss that and see what the process will be.
good, thank you.
All right. Other questions on the providers? So we'll send out an email after this meeting, just reminding people, if people for the Hoosick CAP members, if you want to be part of the soft launch And we'll send a separate email to CPWG. We'll have that in the email for everybody. We'll ask you to review the provider list and see if there's anyone that we've left off. If you would, we will also ask if you would be interested or would like to distribute posters and flyers and fact sheets. We will have you email us so we can get those to you. And then also ask if you have any other ideas or feedback for letting people know about the study, informing people. We'll provide a little summary of what we discussed tonight, but certainly we'll follow up on the text messaging. I think it's a fantastic idea, as well as the local colleges and the libraries and the other organizations that were brought up tonight. So we'll get folks onto our lists for that. And we'll also start planning with our clinic staff in Hoosick an open house for sometime in February. And Newburgh, we can decide if that's the way to go. But we'll also be working with our Ward 1 folks and all of the CAP members on scheduling several events in Ward 1 for the first couple months of the recruitment to let people know. And we'll spread those out so that we're just kind of a constant presence with those activities, in addition to the other types of information we're going to be sharing over Twitter and shared media and newspapers and hopefully some word of mouth and school board meetings and things like that. So we're going to get a big calendar and I'm envisioning a big calendar because that's how I roll. I'm still old fashioned in that way. And we'll get some things down and get a plan together and share that with you over email and just and get your feedback as we start planning things. But if you have ideas, as always, feel free to reach out to us with that. Other comments, questions, issues you want to bring up?
Dr. Bell.
Yeah.
On the provider list, somebody's going to check that over, proofread it. There are a couple of duplications I saw, and at least one address error.
Okay. If you see an address error, unless it's something that should be obvious when you're right, we haven't proofread this yet. This was we pulled this from different sources. So we'll go through and look for duplications and all that. And if you see address errors, and I know Lorraine also has some, feel free to email those to us. And we'll send this out again before we have it go live.
When did you say the press release itself is going out by the end of this week?
We're hoping that the big one that goes out to the federal elected officials, it's cycling through some different eyeballs now as people look at it. So I'm hoping, right, Gina, by the end of the week is the goal.
Yeah, and just to clarify, it's going out as a heads up to state and federal officials, but it's going out to mass media outlets, particularly targeting Hoosick Falls and Newburgh. So that's all I'm hoping going to happen on Thursday, if not sooner. And it's in our plan to give a heads up when we know it's going to go, so y'all can look for it. And link
we'll let you know when it goes out.
Yeah, and if you CC a copy, I'll also make sure to double send it to Gillibrand, Delgado, and
okay.
Yeah, we're taking care of that too.
Yeah.
Lorraine, I know DOH is going to be reaching out to their offices the morning of the release to give them a heads up. And we have those legislative officials on our list to hit up. But yeah, definitely, we'll send it along so you can.
Oh yeah, I'll double duty that one. I'm in touch with them all the time anyway.
Yeah, no, we'll definitely send it out to everybody and get that out and keep you apprised as we start notifying folks.
And just to double check, I think our legislative list included Gillibrand, Schumer, Delgado, as well as the reps for the various villages and the city in those federal and state legislators associated with it. So that's the plan. They're going to mail a copy of the press release just before it goes live, along with contact information for our legislative affairs if they have questions.
Don't forget Sean Patrick Maloney in the Newburgh area.
He was on that list.
Yeah,
Yep.
he's on that list.
And the state legislator, the state senator, Skoufis, he's going to have a press conference on Thursday about water and all.
The water contamination. I sent that to Betsy. Gina, I'll forward you that information.
Yeah, please do, because I want to make sure Elsie has a heads up on that, because
Yeah.
that'd be great. Thank you.
Mr. Lawson sent that to us today. So let me do it right now. Thank you. I forgot to copy Gina on that.
There's also some environmental orgs that I work with around this area that I'll see if they'll put it on Twitter as well.
Okay, that'd be great.
Like EANY, Clean Healthy New York.
Okay.
So.
We've updated the website a little bit, and we're continuing to do that to make it a little bit user-friendly. We're continuing with the literature updates. I know Hoosick Falls folks like that as well. And the National Academy of Medicine Committee that's been formed, and I know Lorene's on the community liaison group, that work continues. We actually have a really long meeting scheduled for Thursday. And the plan is to have that report released sometime this spring. And that is to provide guidance for clinical providers on results. So again, I think there'll be a lot coming out over the next few months in terms of information for communities.
We have a meeting on Thursday.
I have it.
Or do you have a meeting? I was just gonna say,
You're okay.
I don't have the new
That's all right.
calendar yet either.
The scientific side of the committee has,
Okay.
we
You
have to
just
get our
freaked me
writing
out.
done. Yeah. We have a writing meeting over Zoom. This thing's interesting, so, okay. All right, is any other questions, issues? Okay, all right, it's gonna be a really busy time the next few weeks, but we're excited to finally get this going, and I know the communities have fought really hard for this, so I'm hoping we can get going and have folks participate and answer their questions and move forward. So we're looking forward to starting. If you have any questions or you think of something, by all means, reach out to us. And we're happy to do that. So, all right, well, stay warm. Winter has arrived, and we'll speak soon.